Hello virtual viewers, I'm Sonam Beliappa, a junior research fellow at All India Institute of Speech and Hearing. India is fighting COVID-19 and I hope all of you are safe home. Let's make our stay worth by learning new things every day. So today I'm here to discuss a few information about dysphagia with you. So dysphagia is basically, in simple terms, a swallowing problem or a swallowing difficulty. So any problem in swallowing leads to dysphagia. Swallowing is a very pleasurable event, and we know that we enjoy our food, or we know the taste of it by swallowing itself. Like breathing, swallowing is a very important, essential day-to-day life activity which is required by us, and on an average and human swallows around 500 to 700 times per day. So swallowing mainly occurs in four stages. The oral stage, wherein we are intaking the food and the food is chewed into the formation of the bolus. The bolus is propelled to the back of the tongue and moves to the pharynx, and from the pharynx it moves down to the esophagus and to the stomach. So in this pathway, or any problem in this pathway, leads to dysphagia and makes it an unpleasurable event. Swallowing problems or difficulties can be exhibited in a population of any age range, ranging from children, adults to elderly individuals. Most of the time, swallowing or problems or dysphagia is manifested as an problem of any underlying disorder, such as CVA or cerebrovascular accident, stroke, traumatic brain injury, or neurodegenerative disorders such as Parkinson's or multiple sclerosis, and COPD patients or reflex disorder. And children, mostly it is seen in children with cerebral palsy or children with intellectual disabilities. The signs and symptoms of various etiologies leading to dysphagia can vary from individual to individual. However, it is of utmost importance to start with the assessment and treatment as soon as possible, especially in patients with head and neck cancer undergoing radiation or chemotherapy, and chronic pulmonary obstructive disorder too. Recently seen is COVID-19 and the form of SARS-2. Many SLPs have been working in order to improve swallowing functions in these individuals too. So the complaints with respect to swallow can be like a feeling of sensation in the throat or difficulty swallowing because of pain in the throat, painful swallow, excessive drooling of saliva, incoordination of respiration, difficulty in breathing during swallowing, or it can even be a sudden cough or choking while swallowing liquids as well as solids. So it's very important for us to detect even the smallest, slightest change in our swallow, or these symptoms or signs which causes dysphagia, and to know what to be done next in case we see any signs and symptoms as such. As dysphagia can sometimes be life-threatening too. Because it leads to malnutrition, dehydration, depression, and ultimately a poor quality of life, as it impairs us from enjoying meals at a social situation. As a general rule of thumb, in order to prevent dysphagia, we first need to prevent the cause leading to dysphagia, that is Parkinson's disease, cancers, accidents, stroke, etc. So the same things to prevent these disorders holds good even to prevent dysphagia, like a balanced diet, leading a healthy lifestyle, avoiding alcohol and smoking, to be active and fit by exercising and doing yoga, to build our immune system in order to avoid infection that might cause pneumonia or other pulmonary disorders. Chew and eat peacefully and not hastily, to maintain a good oral hygiene. This is of utmost importance. To maintain a good posture, usually upright position while eating, take small bites and sip, avoid talking while eating and avoid distractions too. When one side of the mouth is weak, place the food on the stronger side. Eat in a relaxed, comfortable environment. Take a brief walk to increase gravitational digestion of the muscles, and eating small meals frequently instead of large meals. And this holds good not only for the population having dysphagia, even the normal individuals can practice these habits in order to avoid dysphagia. So The first thing, the moment you detect dysphagia or you feel like you have a dysphagic complaint, the first thing you do is to consult a medical or a healthcare professional dealing with dysphagia, which includes a speech language pathologist, ENT specialist, a gastroenterologist, or a neurologist. So on seeking help from a speech language pathologist will assess you in the assessment as treatment as soon as possible. Once the assessment is done based upon the underlying symptoms as well as based on your pathological condition, the treatment plan will be made, which includes the compensatory techniques like altering the posture of swallowing, or altering the consistency of food, or altering the quantity of food given, or a rehabilitative technique which mainly focuses on long-term effect of swallowing or swallow musculature, strengthening the swallow musculature, oromuscular exercises, as well as stimulation or thermotactile stimulation, and specific techniques based on your symptom exhibited and the underlying disorder. So it's recommended that none of you try any of the swallow techniques by yourself without any expert supervision, as it can be fatal and it can lead to hazardous problems in future. Caution signs include sudden appearance of respiratory symptoms such as severe coughing while eating and drinking, sudden voice change such as hoarseness or gargling noise after swallowing, pocketing of food to one side of the mouth, and sometimes in cases of pre-existing disorders such as Parkinson's, dementia, and other cognitive disorders. Parkinson's can be asymptomatic, that is, it will not show any symptoms. In such case, it is of utmost importance to get yourself or your dear one screened for the presence of dysphagia. And finally, early management is essential to avoid serious complications like choking and malnutrition. So consult your speech language pathologist as soon as possible, and it would be our pleasure to make your swallowing a pleasurable event. As we mainly aim and work at improving the quality of life of every individual. Stay home, stay safe. Thank you.